Hi, you guys. Nurse Goldilocks here. So, I wanted to talk about a case that happened over the weekend. It involved a nurse by the name of Joyce Grayson from Willimantic, Connecticut. So, she had responded to a call at a transitional house on Chapman Street this past weekend. It was a place for registered sex offenders to transition back into society. So I know some of you are probably like, well, who would take such a dangerous assignment? But just to give you a backstory, she worked with the State Department in mental health and addiction services for quite some time. She was a foster parent to 35 kids between the years of 2002 to 2021. So this is a person who clearly gives back. And, that's just, I guess, what her, life journey was, to give back, take care of people in need. And so, this is just a little bit of the backstory of I guess, why she took this assignment. So the assignment should have lasted about 8 minutes. Police were contacted after around 2 p.m. when family members became to, they started to get concerned, and she had not been showing up at her next scheduled appointments. After showing up, the police had discovered that she was found dead in the basement. They suspect 30-year-old Michael Reese. I'll show you his picture just a second. So this is the alleged suspect. So far, he's only been charged with probation violation, possession of drug paraphernalia, and larceny. Now, it's alleged that he is a suspect in this murder, that he had a monitoring device that had appeared to be tampered with. And, I just wanted to speak on this. As a nurse, let me get rid of this filth. So as a nurse, I've primarily done ICU, ER, all of the ICUs, ER, med-surg, LTAC. I've always shied away from home health because of things. First, because of pets. I don't do pets. And I know to people that love pets, their pets are like their children. They don't want to put them up. And I know you feel like Kojo wouldn't bite you, but Kojo don't know me, okay? So I just wasn't willing to take that chance. And you don't know what neighborhood you're going to. You don't know who's going to be at the house. It was just too risky for me. Between that and corrections, that just ain't my cup of tea, okay? It's bad enough that in a regular hospital setting, you have instances where there are shootings, etc., that take place. But my thing is this. This is an unfortunate situation because not only does it, take from people who really need these services, who are, bedridden, can't afford to be in the hospital, need people, who can come visit them around the clock. This kind of, this hurts them because it makes people not want to do these services. In addition to that, when being a nurse, we're at the point where it's just a daily risk. Nursing is climbing to the point where it's one of the most dangerous professions. Like it's really up there. You walk into a room, you don't know if that patient's gonna flip out on you, if they're gonna harm you. You don't know if that's gonna be your last day. You don't know if somebody's gonna kick down the door. Like, it's just so risky, and we come to work to take care of people, right? And because of that, we face our lives possibly being taken, getting hurt. I can't count the number of times I've been hit. Not to the point where I had to go see a doctor or anything, but just hit in general. And it's a lot of, patients who are, maybe, drug overdose, intoxicated, dementia, Alzheimer's. But, it's a dangerous field. And I just try to keep that in the back of my mind and don't underestimate anybody. So I have so many questions, like at these halfway houses, is there not like a guard? I don't know how this works, but like, no. So it's just, this is supposed to be for rehab, but who are monitoring, these people at these halfway houses? And, this woman was, I want to say they said around 63 years old. She's been known for caring for people, most of her life. And, they initially were able to track her down because of the GPS. They said they found her car. They had the canines, sniff out her scent, which led them back to the house, and that's how they found her in the basement. And that's when they saw Reese trying to leave out the back door. He was in possession of her keys to a Hyundai, along with some credit cards. So, there's that. So, at what point are we just going to have some better protection in place for people in healthcare? Because again, we go there to help rehabilitate you, to help treat you, and then we have to also, in the back of our minds, be conscious that this person could still turn around and harm us or take our life. So, I just wanted to talk on this story because, it just makes you want to get out of bedside. And there's already a shortage of nurses. So, there has to be something better that can be done. So I just wanted to hear what you guys thought, so feel free to chime in and let me know what you think about it.